Hello and welcome. My name is Rachel Krug, and I'm the CEO of Virtual Field. Virtual Field is an exceptional eye exam experience with visual fields, color vision, and pupillometry exams in a portable, patient-friendly headset. And I'm joined today by Dr. Sharma. Dr. Sharma, would you mind briefly introducing yourself?
Sure. Welcome. It's a pleasure to be here, Rachel. I really appreciate it. So I guess I wear a few different hats. I'm a professor of ophthalmology at Queen's University in Canada. For those of you in the US, we're like 2 hours north of Syracuse. Rachel's in Boston, so I actually trained in Philly. I did actually three. It took me a while to figure out the retina world. So I did 3 fellowships in retina. One here at Queen's University, one at Wills Eye Hospital in Philadelphia, one at Mass Eye here in Boston. And I guess I've worn a number of hats for a while. I do a lot of research in medical education and health economics, but we put together a number of platforms. One of which is Opticase, which reaches like 22,000 eye doctors, and a bit of a labor of love. We put together something called MEDSKL, which essentially is kind of like medical school in a black box, I guess. So we reach students from 500 universities on that platform.
That's amazing. In addition to your work on these educational platforms, I know you also are your son's agent and he is an artist. Can you tell us a little bit about that and how that shapes what you do?
Yeah, absolutely. So I mean, it's kind of an interesting story. Evan's now 21, but when he was probably 10 or 11, we happened to be in Paris. I took him to the Louvre. My wife and I took him to the Louvre, and he was looking at these giant paintings, and he was looking at each one for like 5 or 10 minutes. And I was like, "Come on, Evan, let's go, let's go." And when we got back to Canada, he just started painting, kind of fiendish, like it. He was painting all the time. And probably by the third or fourth painting, I said to my wife, like, "Hey, that's actually pretty good. I would buy that painting." And so what happened was, he for a school project, he decided to do like kind of history of Kingston artists.
Mm.
He interviewed an artist, and she said, "Oh, why don't you apply to this show?" And I think she meant when he was like 20 or 30. Anyway, he came back from that, and he applied for this show. It actually ended up being Canada's largest juried art show, but he got in the show when he was 12. And so it opened up a whole other world where, I had to sort of manage his career. And yeah, it's been a crazy, crazy ride. I mean, in fact, just a few months ago, he got a commission piece into the New York Stock Exchange. So it's
Wow.
yeah, it's been pretty fun for sure.
That's amazing. Shifting gears to focus on continuing education, I do have a few questions prepared, and certainly if anybody who has joined has questions, you can put them in the chat and we will address them. To start out, why do you think having a structured learning plan is essential for doctors in today's rapidly changing landscape?
Yeah, I mean, it's a good question. I mean, I think there's a couple of ways to look at it, right? I think, I don't land right on all structure, right? So, like being an epidemiologist, I love structure, in terms of frameworks, and making sure that you have a very cohesive plan. But I would also say that, it's critically important. I mean, things are changing dramatically now, right? There's a quote like in medical school, 50% of what you learn in medical school will be obsolete by the time you graduate. So, um, while structure I think is great, I mean, if you look at everything from ChatGPT, just like AI, I mean, a lot of things we're playing around with Jasper AI and things even to make images, medical images. So, the one thing that I always tell my fellows and residents and medical students is really to read around cases. So, you've seen something in the clinic. I mean, we just actually had a super interesting case of a congenital macro vessel, which is rare as hen's teeth. And we saw this patient, within the past month or so, and I just saw them again today. But because we read around that case, we realized that 25% of patients with congenital retinal macrovessels actually have intracranial pathology. So we ordered, an MRI on that patient, and it turns out they actually had some venous malformations in their brain. And so it's a sort of just a nice way to remind ourselves that when something's fresh in your mind, it's an interesting case, go home to read about it. So maybe that in a way is a little bit unstructured, but then following kind of the traditional path, is how we traditionally will learn, right? So in our fellowship in retina, we will go through systematically everything from diabetic retinopathy to macular degeneration. So there's no, holes, in our overall, kind of thinking. But it's always nice to really supplement that with what you're seeing on a day-to-day basis.
For sure. And you mentioned AI. Do you think it's important to look beyond traditional medical education and explore topics like AI, health tech, or global health trends? And why or why not?
100%. I mean, I like, again, for me, I'll take you back like 10 years ago when we created the MEDSKL platform. The way I sort of looked at that, and for those of you who don't know, that platform was really built around, the educational systems in Canada and the US are really, geared around 200 learning objectives, right? So, there's five, red eye, acute visual loss, chronic visual loss for ophthalmology. Then there's like 10 chest pain and coughing up blood and stuff like that in different disciplines. And so, you know, being, I mean, I'm a very visual learner. And what I realized is probably 30–40% of people out there are strongly visual learners. And I was like, you know what, the kind of the sage on the stage model, like listening for an hour lecture, really doesn't do justice to how the variety, the vast majority of people learn, especially, people who grew up, with cell phones and, all this sort of technology.
Yeah.
So, 10 years ago, we sort of said, okay, can we do medical school better? And what we did was, I'm like, okay, so we got to teach around these 200 objectives, but what we're going to do is we're going to do it like Pixar. And so I brought in, we built a whole animation studio actually. And those lectures are all whiteboard animations. And then I forced the faculty, like we went out and got, 200 kind of award-winning physicians in different disciplines. And I said, okay, I don't want to hear a 1 hour lecture, right? We're going to do TED Talks. They're going to be 20-minute lectures. And so, we put together something, about a decade ago that I think, was pretty cutting edge, right? And so, like that was V1, and now we're just seeing so much acceleration in different areas, whether it's AI, and AI again. I mean, there's ChatGPT, which is again V1 of AI, but we're just, we're seeing a tremendous growth in video, tremendous growth in, I mean, played around with Jasper AI to create images. And then, you talked about also just, global health and things. I mean, there's so many, a lot of my research is also going super micro. And so I'm quite interested in things like the microbiome. We have, we're looking at something called GRIM age testing. So biologic age versus chronologic age and macular degeneration. So a lot of these, new concepts that are kind of exploding and changing personalized medicine, I think is absolutely critical. Whether you're an optometrist, an ophthalmologist, PhD in health in vision sciences, you really got to keep on top of these trends, because ultimately our patients are going to be walking in, asking questions around these, and it's I think it's important to know them.
Thanks for sharing that. So it's the beginning of the year, and very often at the beginning of the year, we set goals for the year. And some of the goals for the eye doctors on this call are educational. How should our doctors and community think about planning out their continuing education for the year? Should they be looking for gaps in their knowledge, keeping up with these trends? There's a wealth of things that could be covered. How should they start to think about that?
I think that's a great way to sort of think through things. I mean, I've been a huge fan, actually, personally, of planning my year out. And I do it, I don't know if some of the people on the call here, and you feel free to use the chat. Stephen Covey was really quite influential for me. I mean, I remember in my medical school, I think it was my father, gave me 7 Habits of Highly Effective People. Rachel, I don't know if I mentioned this to you or not, but my brother's written a bunch of books. He's written a book called The 5 a.m. Club. And
Yeah.
he's the monk who sold his Ferrari, a bunch of books like that. His name is Robin Sharma. So he's kind of in the whole space of, personal leadership, and we kind of, share some ideas and things. But early on, I actually had a planner, the Stephen Covey planner. And so, the concept of quadrant two thinking, where, it's not urgent, not important, but ultimately, it is super important, or I should say it's not urgent, but it is super important. And that the planning is of critical importance. The other really important person that I was introduced to, and I actually interviewed him for one of our podcasts, is a guy named James Clear. And James
Mhm.
Clear is huge on habits. And so,
Mhm.
thinking through both of those things together, for those of you who are reaching in the kind of personal development space, I think is really, really good. So what I typically do is I'd like to do a bit of a needs-based assessment, like where do I see core weaknesses in? And I mean, it could be in a therapeutic area like macular degeneration or diabetic retinopathy, or, it could be more kind of systems thinking, right? And it could be like how to manage people better, how to hire and fire people better, um, how to, maybe even like, hey, I'm interested in developing a personal brand online. How can I leverage, LinkedIn or Instagram or whatever that platform is going to be. So all of these skills, I think, are really very important, as we're moving forward. The second thing, though, is I would always, recommend, again, I mean, it's great to have plans, but plans definitely change, right? And so again, for me, if something becomes really top of mind, like if I see just a super interesting case that I want to do a deeper dive on, that's a pretty cool way to then say, hey, I'm going to see this patient in a month's time. It'd be great if I can tell them exactly what's happening, cutting edge, in this lab, for instance, whether it's Mass Eye and Ear or whether it's Hopkins, and see what's going on in retinitis pigmentosa, for instance.
That's fair. So develop a plan, but then be willing to go where your interests take you.
100%.
Awesome. To dive into that a little bit more, what advice would you give to a doctor who's looking to deepen their expertise in a new area or a new subspecialty?
I've been a huge fan of kind of lateral thinking. And so, you know, I mean, I again, like the past 5 to 7 years, I've learned a huge amount in areas like the microbiome. And so it sort of necessitated, like, even though I didn't take, time off to do a fellowship in the area, it's just sort of doing deeper learning, or because I'm in a university, I can call my colleagues, who are PhDs in this certain area. And, we've learned a lot about, just looking at, microbial DNA and, the subunits like 16S, RNA sequencing, things like that. So, I think, and again, leveraging kind of AI, it's amazing how quickly you can learn, at least get to, 50 to 60 to 70% on a topic. It doesn't require, 3,000 hours anymore, like forget about 10,000 hours, but, probably in 10 hours, you can get up to speed into things that are pretty quick. So, I would say, you can get to a certain level by learning on your own. But if you really want to become an expert in an area, either take an online course or try to, take time out, whether it's a kind of a mini fellowship for a month, or even just shadowing someone, for a day. They'll teach you a lot of very, very practical skills. So if you have access to those, those sorts of things, what we've put a lot of emphasis on Opticase in particular, is really upskilling, eye doctors. And so on a monthly basis, we bring in a world expert. We try to
Mhm.
really emphasize skills as opposed to more pure didactic learning.
Mhm.
And then we also do, regular tips on a weekly basis that give you pretty granular skills as well. So
That's great advice. And you started to talk a little bit about non-clinical skills like leadership or business management. And I had no idea Robin Sharma was your brother. I'm a fan, so definitely reading your brother's books. But what else could a doctor do to incorporate those non-clinical skills?
yeah, I think again, it depends on how passionate you are and your bandwidth and kind of your time. So I mean, I actually, after when I came back to Canada, I actually went to graduate school. So I've actually gone to graduate school twice after becoming an ophthalmologist. Did a master's in epidemiology before I did my fellowships, and when I came back, I did an MBA. And so it was an executive MBA, so it was like every other week, on Saturday, on what, Friday and Saturday. So it was a 21-month commitment. But there's watered down versions of that. There's 3-week courses in the summer that you could do, all the way down to micro learning, right? So, you can do master classes, you can do, I mean, I've hired coaches in a lot of different areas. I've worked with people like Dan Martell who are, great in the sort of SaaS world. Just different people that I think who I love their thoughts, and then I'll reach out to them and say, hey, can we chat? And do you have, a coaching group that you're working with? And so there's certain skills that I think I, need a deeper dive on. And so I'll purchase those skills, either through online courses or direct mentorship.
Awesome. Given how much information is out there, what advice would you offer to doctors who might feel overwhelmed by the amount of information they need to keep up with in their field?
Yeah, I think really you need to set aside some time. Like if again, I'll lean back onto James Clear. I think the more that you can systematize things, the more that the things become a habit, the more likely it's just, is going to get done, right? So if you can earmark, even if it is 15 minutes to 20 minutes a day, maybe it's, getting up a little bit earlier, maybe it's turning off, whether it's Instagram or TikTok or whatever,
Right.
just
Yeah.
having a little holiday, or, having a 1 hour time where you dedicate it to yourself or your learning. Like that's just a nice way to build things in, I think. And I think the second thing is, try to surround yourself with people who are like-minded. Not necessarily, I don't mean to say, they need to be clinicians. I mean, I learn a lot from incredible artists, or just different business people that I just, and what we really share is passion, right? We share passion for learning and passion for discussing interesting ideas. And so I think when you surround yourself with people like that, it just seems to open up channels in your own brain to start to pick things up that you may not have access to.
Amazing. I love that, the passion for learning. We have just a few minutes left, so if anybody has a question, please feel free to put it in the chat now. And let's turn gears to OptoCase and MedSkill. I'd love you to talk a little bit about how those platforms support doctors' learning plans, and how people could leverage those for their own continuing education.
Sure. So for this particular audience, I would say OptiCase is probably, the most interesting one. So, we've done everything from, it's a CE platform, so people can, kind of get, there's 30, 40 hours of CE credit there, either case-based learning or video-based learning. And then we've layered on, regular tips. So it's a free open access platform, to get those tips. So every week we create an OCT tip. And then we also bring in, kind of quote unquote coaches in different areas. So there's, glaucoma coaches and cornea coaches that they're presenting really, super interesting cases. The MedSkill platform is more, geared towards if you want to learn, kind of a broader base in a lot of different areas. And so we've got everything from, pharmacists to nurses to medical doctors and medical students on the platform. And, very similar to OptiCase, there's, kind of evergreen content that's there. But then we layer on, live events on a regular basis, and tips that come in, through emails on a regular basis. So, it's yeah, it's the kind of way that I think I want to learn. It's, video based, but then as you're getting these inbound things on a regular basis, it sort of keeps you, and they're just micro doses, right? So each time it's only like 2 to 3 minutes of learning, but it keeps you on top of things.
What inspired you to create these platforms? Clearly, you have a love of learning and a passion for learning, but what else inspired you?
Yeah, it's a great question. I mean, I think I've always been, I guess, someone who's been pretty innovative and somewhat creative. Like, although I didn't go, quite into the art space, or writing like my brother did, but I just I was like kind of a cinemaphile. I loved movies, and I loved, playing in music bands and things like that. And so this was a way for me to really use that creative energy, but in I'm a huge thinker of Venn diagrams, and so again, like the things that I feel I'm pretty strong in are, kind of eyes and education, and business and creativity, and it all just sort of came together on these platforms.
That's amazing. Well, thank you for sharing your thoughts on developing a 2025 learning plan and being a lifelong learner. I appreciate your time very much, Dr. Sharma, and thanks to everybody who joined. We'll see you next time.
And a pleasure. Take care, Rachel.
Bye.
Bye-bye.